My name is Brenda Mallon. I am a senior researcher in the Institute Gustave Roussy, but today I am PhD in epidemiology, and I work almost totally with the French African Pediatric Oncology group, GFAOP. That's since sort of 6 months I've been working, but I joined the group in 2000, so I've been actually a founder member. It's a non-government organization, so I've decided just recently to devote myself, and the Gustave Roussy have allowed me to. I still am part of the institute, but it's my sort of choice of a changing in my way of approaching my work as very different now, working totally in Africa. I think bringing innovation into healthcare systems, there are two big challenges. It's education and financing. One of the things for us, at least in working in developing countries, it's the sustainability of things that we get involved in, projects that we run, having access to medication, and developing all of those programs, but they're so dependent on outside financing and governments that are not coming up with the cancer plan. It's an idea, but it's actually, sometimes it's there, but it's not actually implemented. Sometimes, in fact, all of the things are sort of linked for me to the financing and the education. There's an education of the administrators, and also an education of the population to understand that cancer actually can be cured, that healthcare systems, when they're structured and they have properly trained staff, properly educated medical staff, nursing staff and so on, that cure is possible. So I see all of those things really as important issues for public health and management. You know, what we were in UICC at an international level with World Health Organization to lobby at governmental levels. I think you can come in as NGOs and you can do a lot of work and you can bring a lot of finance, but the day you close the door, if you haven't worked hand in hand with governments, it falls apart. I think there needs to be sort of like we were just talking just now about federal involvement to actually allow universities to have access to medical journals, things like that, that it has to happen at a global level. It has to happen. If we just work individually with countries, I don't think it's not sustainable. I've been 24 years watching things that you start, governments change, the thing falls apart. Even when you can work with governments, but a lot of the time it's very hard to get governments to work, you know, unless there's some sort of, they see an interest. And again, that's education. When you have maybe Minister for Health who has been, we've worked sometimes with Ministers for Health who've been part of our organization. When they get into ministerial positions, they really move things. It changes the whole situation for us. It's much easier to work when people have that education. They know what we do, and they're interested in actually changing things fundamentally and opening up hospitals for treatment of childhood cancer. You know, but otherwise, if we're just coming in, not working with governments, it's very hard.